So Madeleine's joining us. She's a community outreach, works in the community outreach area for the Hawkesbury Nepean Valley Flood Management Directorate. Plus, we'll be joined by Meagan that has been doing a lot of work with Hawkesbury City Council, and also Jessica Innes, who's the CEO from Peppercorn Services. And I think it was perfect timing that these three people came together who really wanted to do great work for their community, and it really shows the importance of collaboration partnership, but also a really shared vision of where work can be taken and where it can go when you've got three really dynamic people working together, which has, I think, been some of the success of some of this work has really been because of these three great women. So I am going to start by handing it over to Madeleine. And thank you so much to all three of you. Looking forward to hearing all about it.
Thanks, Catherine, and thanks, Charlotte, for sharing our screen. Just before I start, I'd like to say that I'm joining you from Darug and Gundungurra country in the beautiful Blue Mountains that I'm lucky to call home. So yeah, we're talking about a collaborative journey that we've been on, which is really around connection, preparedness and response, and we really have focused in on communities at highest risk. Thanks, Charlotte. Next slide. Just really quickly, just have some icons of some of the other partners we've worked in. We just want to highlight that while you're hearing from Hawkesbury, Peppercorn and ourselves today, there's been other people involved in this work and we just want to call them out. Thanks, Charlotte. I just want to start just because I think it's useful for context. The Hawkesbury Nepean has one of the highest flood risks in New South Wales, if not Australia. It covers around 500 square kilometres in Western Sydney and includes a series of unique catchment characteristics which really add to the risk to life and property. And the map on the side shows you sort of the extent of that floodplain. So it's a really massive floodplain area. So we've got a large population, over 140,000 people live and work in that catchment. We've got significant cultural and linguistic diversity, particularly in some of those key councils. There's a really mixed land use. So we've got really dense suburban areas right out to sort of rural holdings and really quite remote areas in parts of the catchment. There's a high turnover of residents. So around a third have only lived in the catchment, have lived in the catchment less than 5 years. There's a really constrained network of evacuation roads to get yourself out of the floodplain. There's high numbers of social housing tenants. There's significant geographic isolation in certain pockets of this catchment and a real clustering of social disadvantage in areas of highest risk. Thanks, Charlotte. Even though we're going to be focusing in on the community outreach and building capacity through local partnerships, I just want to say that the Flood Risk Directorate that I work in part of there's a whole range of community resilience initiatives, and one of them is around this building aware, prepared and resilient communities to floods. And I just want to but just note that there's a whole range of other components to this work, which include broader campaigns, work we've done with schools, a whole lot of comms resources, etc. So I just want to acknowledge that it's part of a much broader package of work. Thanks, Charlotte. Even though we're going to be speaking about some particular communities at highest risk, I just want to say that we did spend quite a lot of time thinking about who was most at risk in potential floods in the Hawkesbury Nepean Valley. We've got 8 LGAs, 4 are the key LGAs where most of the flood risk occurs. And we did spend a lot of time looking at ABS data, community profiles from councils, talking to community NGOs, doing our own social research, and also looking at what the national and international data says about who's most vulnerable to disasters. Thanks, Charlotte. And I just wanted to say, even though we're touching on a couple of these communities today, we identified these key areas for work for us. So this could look different for you guys, but this is what some of the key areas of need were in our communities. And so we're focusing a bit on today on the caravan park residents, and it crosses over a little bit into tenants in social housing, but just wanted you to see the sort of broad range of communities we identified as being at highest risk in our local government areas. Thanks, Charlotte. And we really did focus in on how we could build capability and capacity across our floodplain. And so we ran a lot of workshops for staff, workers, volunteers, etc., across our local government areas. And the three aims of that were, how do we build flood awareness and preparedness? And when we started, we were in the middle of a drought. So I need to tell you that flood awareness was very low. We really wanted to help people understand how floods could impact their business as usual, and particularly business continuity or service continuity. And we really wanted anyone who worked or lived in the floodplain to really understand that service providers, how they might be able to translate their learnings into support for their clients or residents or students or whoever it was that they worked with. But a key element I wanted to hold up, because I think it's useful and I think it underpins the work that Jess and Meagan and I went on to do together, was we ran a series of workshops where we actually brought what are usually disparate sectors together. So we brought emergency services staff from New South Wales SES with our local council staff and local key community service providers, and that included Jess at Peppercorn, it included key community housing providers. We really wanted to, one, build confidence in the community sector, and for really to help them feel confident in understanding flood risk. We wanted them to really see their vital and unique role in this work. We really wanted emergency services to share the natural hazard knowledge they had, and we really wanted, what you see on the right is a map. So we did a set of things around, the map you're seeing is actually showing social housing, where their housing, where their residents were in relationship to flood risk at different layers of flood risk. So a 1 in 50 chance per year flood, a 1 in 100 chance per year, a 1 in 200, up to what could be the worst possible flood. So a lot of it was helping people visualize risk. So we wanted service providers to go, I can actually see what sort of flood would impact which of my tenants or which of my clients or which of the families I work with. And then we really wanted some quite deep listening on the emergency services behalf to what sort of expertise, knowledge and skills the community sector have. And I don't need to tell all of you, it's vast. They know where their clients live, they know who they are, they know what their needs are, they know what people's strengths are. And we really then spent time in these workshops identifying what are the barriers that people might face, what are the strengths that they might bring, and what are the needs people might have. And we wanted to do this pre-event. We didn't want to be trying to make up this stuff at the last minute. So a lot of this helped us identify, for example, in South Windsor, community service providers and housing providers were able to say to SES, when you go to evacuate South Windsor, you need to know that we have a lot of clients who have high support needs, no mobility, don't have a car, high caring responsibilities, don't have anywhere safe to go, etc. So like it complicates, but creates nuance to, that's not just a suburb. These are a set of individuals. These are some of the needs you might find. These are the things we need to think about beforehand. Next slide, Charlotte. So I just wanted to finish and really want to hand over so that Meagan and Jess can talk about how we did that work together. But I just to finish, this is just some examples of some of the diverse, I guess, workshops and events we ran with different community partners across the floodplain. But with that, I'd really like to hand over to Meagan so she can talk about how we work together with local councils.
That's great. Thanks, Maddie. And it's fantastic to be here. I've already kind of been taken back to the time of early work and been reflecting on our learnings that we've been really fortunate to, been able to apply through multiple disasters just in the initial breakout and intro. So it's lovely to be here. As said, my name's Meagan. I work at Hawkesbury City Council. I am really fortunate to live and work in the area, and I'm on Darug country as well, Maddie. So in 2018, when Council initially started working with Infrastructure New South Wales with regards to the flood preparedness program, I was managing the community services team. At that time, it was a pretty small team. I think we had about 4.5 FTE, which is pretty reflective of the size of the population in the Hawkesbury, which sits at around 70,000. So the community services team undertakes activities that are fairly typical of any team in local government. And sorry, Charlotte, I'll get you to move to the next slide. I just realised that. Thank you, Ta. Sorry, so the community services team undertakes activities that are fairly typical of community services teams within local government. So we provide sector support in that we receive a small amount of funding from both state and federal government to work with predominantly aged and disability services. But we do also work with services that essentially provide support to people in need in the community. And that includes domestic violence services, youth services, multicultural services, Aboriginal and mental health services, just to name a few. In addition to working specifically with those services one-on-one, the team also facilitates interagencies, which is really about fostering partnerships and collaborations within our local service system for the benefit of the community. Our team also provides support to volunteer management committees across our community, and we are what's classed as peri-urban here, so we're really on the rural periphery of Sydney and have some fairly rural and remote communities. The team also undertakes community facilities management. So I think all up, we probably manage about, say, 24 community centres across the region. So when Madeleine from Infrastructure New South Wales first approached Council in 2018, her focus was really on identifying what our existing pathways were. And together we looked for opportunities for Council to work with Infrastructure New South Wales to work through our existing service networks to support delivery of flood preparedness education. As Maddie said, it was a bit of a hard sell. You know, we were well and truly in quite an entrenched drought at that period of time. But the focus of the project was really around getting some baseline understanding of what the existing community knowledge was in terms of flood risk, and really trying to overlay that thinking into business as usual for community centres. These are spaces where people come for support. And therefore it just was, you know, a natural starting point for this work. So was to really overlay flood risk and preparedness into business as usual and get the community services system thinking about how they could be part of this solution. As I said, at Council, we're a pretty small team and very resourceful. So we saw this as a fantastic opportunity to access resources and expertise that will build capability of local services to better respond to flood risks that exist in the Hawkesbury, and also to improve our own internal knowledge and capability, because at that point in time, disaster preparedness or certainly disaster recovery was not a space that Council had ever been in before. So we really lent into networks of services that we were already working with. This wasn't about establishing anything new. It was about using our existing relationships and resources to connect Infrastructure New South Wales with the communities that they'd already identified. And we provided plenty of opportunities for Maddie to connect with our local interagencies to secure community service partners to really engage with the broad range of work that she was tasked with rolling out. Council had been part of the Person-Centred Emergency Preparedness Program, which I think Michelle Villeneuve has actually presented to this group previously. We've been part of that pilot in 2014, so we were really excited to actually re-engage with the program through Infrastructure New South Wales. And to build on the work that had already been done in this area to focus on flood preparedness, specifically with our emergency response agencies and people with a disability. As Maddie said, it was a really challenging time. Again, despite the range of resources that we had available and education, getting people thinking around flood risk was really challenging, and it was probably further challenged by the extensive bushfires that we experienced in 2019 and 2020. Subsequent to those bushfires, Council actually received funding through the then Resilience New South Wales for a community recovery officer. And we were really fortunate to, I guess, already have that disaster preparedness and recovery thinking that had been undertaken in terms of flood to build on for the bushfire work. So next slide, please, Charlotte. So it was in early 2021, following some really significant advocacy that Maddie had led quite tenaciously, that a community liaison role was actually appointed as a functional area on the local emergency management committee. And I know that somebody had touched on earlier at the opening of this presentation, that's something that I think emergency response agencies and certainly local governments and community sectors know is a critical missing piece. But for a variety of reasons, having that established as a functional area on local emergency management committees has been a source of much resistance for some length of time. So, you know, hats off to Maddie for her tenacity and persistence in getting that function appointed as a critical role in the LEMC. I think I've been on the LEMC for about 3 weeks when the Hawkesbury experienced a significant flood event in March 2021. So the local emergency management committee actually becomes an emergency operations centre during a disaster. And being there, it became really apparent really quickly that the local knowledge held by my role was of enormous value. But also that advising the response agencies of what was needed in terms of being able to safely evacuate residents most at risk, lean into our plethora of local community services to really look at that early response for people who are really vulnerable in the community. That would have had its limitations on the Emergency Management Committee had we not had an external agency such as Peppercorn that we could lean into and contact and really leverage the staff, their physical resources and their local expertise to engage with people at that time of crisis. We worked predominantly through Peppercorn Services to establish recovery centres and were able to advocate for recovery support services to be stood up really early in recovery to ensure continuity of support. The then Resilience New South Wales were incredibly supportive of this work and the work of Infrastructure New South Wales in establishing those relationships prior to the disaster was really pivotal to the success early on in the piece. Now, Jess Peppercorn's going to walk you through the practicalities of the extensive work that was undertaken not only by Peppercorn, but a range of community agencies early in recovery and also into what unfortunately was subsequent disasters experience. But from a local government perspective, recovery has been a changing process and we've needed to constantly be responsive to our community's need. From going from a team of only 4.5 in 2018, Council's been able to extend its recovery service. And we've actually attracted quite significant grant funds and we currently have 9 people in the branch as opposed to, so the branch has doubled in size and essentially the additional resources are all focused on recovery and preparedness and have really enabled us to engage quite broadly with services and vulnerable people living in our outlying disaster impacted communities. So as I said, the benefits of the work of the Infrastructure New South Wales project and also having a community liaison role on the LENC was able to be built on our learnings from 2021 were of enormous benefit in both the March and July floods from 2022. And I'll hand over to Jess to talk around, I guess, from a community service agency and a partner of council, what the experience has been working in disaster recovery. Thanks.
So as Meagan sort of said, I'm joining you all today too from Lands of Direct People today. It's beautiful and sunny here in the Hawkesbury, so I'm going to have some coffee in the sun when we finish today. But we all started, I remember sitting in a community forum, an interagency that Hawkesbury City hosts on a bi-monthly basis. Infrastructure came and presented about the flood risk and there was a bit of a call for providers to sort of look at what a shared responsibility framework might look like. And I remember sitting there watching and not one provider went up to infrastructure. I thought, oh my golly gosh, what's going to happen if it actually does flood here in the Hawkesbury? And what might our role as a service provider be in looking after some of these more at risk and higher risk communities? So we took a next step as our organisation, being Peppercorn Services, to engage further training with SES and infrastructure to work with our whole workforce at Peppercorn Services. So we're a community transport provider, aged services provider, disability services and family services. They are the communities and services we look to provide predominantly our services to. So we brought a lot of our frontline workforce in. I thought, well, hang on, I can't have them talking to the community about risk if they don't understand the risk for themselves. But it was also part of an approach to help them understand what business continuity and service continuity may or may not look like in a sense of a natural disaster. So that was a really great, worthwhile training. And then we took it to the next stage of, and with Meagan and Maddie's assistance through infrastructure and council, to engage with the university's PSEP program to do some training with the workforce to, I suppose, look at that frontline approach to engaging conversations on emergency preparedness with our clients. So that's where it all sort of started. And then if we flick to the next one, thanks, Charlotte. We got to the training, and as you can see there from the March 2021 flood, we didn't get much further than that, and it flooded. So the beauty of where we'd landed, and whilst we felt that we hadn't done a lot of work in preparing our communities, we had just done the training, was that our organisation actually could start to understand what this natural disaster was doing. They weren't afraid of what was happening. It was from we built some capacity. So we were starting to look at, I suppose, where our staff are positioned, and it was a bit of a, flying the plane, building the plane as it was flying at that stage. And then what had happened, because council had stepped into the emergency operations team and the LEMC, the local emergency management committee space, we got a phone call as a community transport provider to say, look, there's a community of residents who had returned to a caravan park whose properties that were uninhabitable any longer, and could we assist in helping them move back out at a 10-day evacuation centre and be supported to get temporary housing. So we went into that caravan park to help some of those residents move out, again, from uninhabitable dwellings. And we were really, really quite concerned about what we had found. So what we did, we were at that stage was just communicating back through to the emergency operations team around what the impact of this natural disaster was on that community. So from there on, without going into all the detail, but we did a lot of advocacy in providing and working towards a recovery support service for the residents of one particular caravan park. So there was about 60 residents who had completely lost their homes and their dwellings and all their belongings. They had no knowledge that they were in a flood zone. So the devastation of everything was very, very apparent very quickly. Thanks, Charlotte. So whilst this was all happening, we as an organisation were looking at our own business continuity. So we found this community, but at the same time we had, following the flood, had some landslides that had happened further up the mountains, which inhibited any movement in or out of the region. We were at the time we're at risk of power failure, telecommunications being cut off and so forth. So we were sort of trying to work out, well, how do we continue to operate as best we can, a community transport organisation, and serve the community with all of the other things happening. Thanks, Charlotte. So then with one of the things that I suppose in the moment and some of the pre-planning work that we had done was we really start looking at what our responsibility is in a natural disaster. So we're bound by aged care and NDIS standards, of which some of the standards talk to emergency planning and risk planning. So we sort of did look at, well, hang on, are we in breach of any of the things in our contract, or can we actually take some active role here to work with these higher risk communities? So we felt that we were actually acting within the standards to identify communities at risk and take whatever necessary steps to not be an emergency response agency, but to actually identify, the risks and help mitigate them at that actual time. Thanks, Charlotte. So with the University of Sydney's Person-Centred Emergency Planning Preparedness Framework, we really identified that within the industry standards, the principles of PCEP really, really gelled really quite well in terms of it was a really practical tool that we could go and engage with our community on. So all the work that we had done pre-flood was all sort of coming to fruition, that we realised we had communities who were returning back to inhabitable buildings who had never had a discussion on preparedness, yet now they're in this situation of returning back there. So we actually started looking at preparedness as being something that needed to happen as part of the recovery. We're lucky we started that because within 4 or 5 weeks later, we had another flood. So the waters dropped and then came back up again. Thanks, Charlotte. So as I've said, I suppose when we start talking about the PCEP modelling, community transport's one of the key areas that, well, one of the 8 areas that we get our clients to start talking about preparedness and what they might need. So we were really quite concerned that if they were talking about emergency preparedness and they sort of said, oh, yes, I have a transport plan and my plan is to call Peppercorn. We did some metrics and understanding of what that might mean as a community transport provider. So just to give you an idea, we identified 47 residents that were living on a high-risk floodplain following the first flood, of which 47 residents who needed high dependency, so needed hoist transport, which is not something you can just call the neighbour and say, can you pop me in the car? We've got to get out of here. We have only 10 buses and we only have 10 drivers. So of which those 10 drivers, majority of them lived on the floodplains themselves. So we're going to be cut off. So we did a whole heap of work around business continuity and looking at how that would interface with the community at a time in need when they would potentially need us, knowing very well that emergency services don't know who these people are, where they live and what their needs may be. Thanks, Charlotte. So what we started doing with Meagan's role then in connection with Maddie, with the LEMC, Local Emergency Management Committee, we started talking about, well, who's going to get these high risk clients in a crisis sort of situation? Who do we have available as a workforce? Where does our workforce live? Are they even actually available at all? Which we identified the majority of them would not be. We actually started looking at where we might be able to move our community transport vehicles to be positioned should the emergency operations team need to call upon us or call upon the vehicles themselves, that they were positioned in such a way that they were accessible to our emergency management teams. And then we looked at what we might do if telecommunications went down. So there was a whole heap of other things we went into, but effectively, when we started looking at the real high-risk communities, these were the things that we needed to start thinking about. So we presented our dilemmas through to the LEMC, and much to our delight, that's how Meagan sort of a little bit of other work as well, but came to be appointed to the LEMC through that way. Thanks, Charlotte. So then we weighed up, you know, with all of those things that we know that we may have an impacted workforce, how do we actually start to take a role in that space? And we realised we sort of had that shared responsibility and how we might practically do that. Thanks, Charlotte. We'll go to the next one as well. So we took a deeper understanding of looking at the caravan park residents who were impacted in the March 2021 floods, and identified that they had been through a number of life traumas prior to the floods and bushfires that they had experienced. That a number of them had transient accommodation, financial disadvantage, had a number of other dependencies, drugs and alcohol, had a number of them come out of the community justice system and so forth. And one of the other challenges was too, in the floods, they were shift and casual workers. So getting to a recovery centre wasn't a priority, or evacuation centre even. It was like I needed to get to work to be able to pay my bills, pay my rent. So they had all these other life dilemmas that were going on around them. Thanks, Charlotte. So I suppose when you put all those dependencies and things, we sort of identify these communities as quite vulnerable. And that's sort of how we were sort of viewing them in the initial instance. Yeah, next slide. Thanks, Charlotte. We came across one gentleman and one case study in particular of a gentleman who had COPD disorder, so he was having trouble with breathing. By the time the floodwaters were starting to get closed off, there was no time for ambulances to come in and help this gentleman get out. So this is where the role of community transport providers came in. We came in and picked him up and actually took him straight to the emergency department rather than an evacuation centre where he could actually receive adequate health care in that emergency instance. So they'd lost power. He was having trouble with breathing and wheezing and so forth, but there was no time to get an ambulance in there. With the floodwaters rising, roads were going to be cut. Thanks, Charlotte. So what we came to learn about this caravan park community was that they, in returning back to their properties, whilst they were not habitable by any definition, they were very self-organising. They were really well connected with one another, and every person in that community knew who each other was and what their circumstances were. They were very, very open to someone coming in and talking about improving longer term outcomes. So it wasn't necessarily always just about their caravan that they were living on, or their home and the belongings they'd lost, but some of the actual other long-term opportunities to look at, you know, financial disadvantage and all the other elements that they were having. But the strength in how that they operated and relied on one another was really quite amazing. Thanks, Charlotte. So what we did is we looked at the strength of how that existed. We looked at that with an overlay of PCEP. And started working with this caravan park in particular to increase education on for all residents what might happen if it floods here again, and it obviously did then in March 22 and July 2022. So we actually started taking an approach then of every time we had a flood watch and act warning, we would actually call through to Meagan and say, look, we know that there's a high risk here. We're going to go in and talk to the residents about, look, if you would like to collect some of your belongings and we'll get you out. So in the very last flood in July 2021, actually might have been the March 2022, too many floods, we actually had the residents out before the final, the evacuation order was announced. So we managed to mitigate that quite a bit. Thanks, Charlotte. We'll go to the next one as well. In terms of now how we see ourselves as a community transport provider, we really sort of see that we have some assets that we can deploy to the community in a time of need in that preparedness space. We'll go to the next slide. Thanks, Charlotte. So we're now seeing them as a very capable community with just needing a little bit of education around what that flood risk is to be able to make the right adequate decisions and use the appropriate timing for evacuation. Thanks, Charlotte. So yeah, so one of the things that, as Maddie alluded to earlier, we do have a lot of trust and built initiatives. So one of the things I'm thinking, I was posed, how would CROs be able to take back some of these things, and how would they get these communities started? So it's really looking at those agencies who have got the built trust within the communities already, and who are going to be there beyond the recovery component right now. Looking at how you can increase awareness through really creative models. So we just ran a trivia for seniors workshop. So we actually did it on emergency preparedness, and yeah, they didn't know, thought they were coming for tea and scones, and we started talking about emergency planning. We really started looking at any grant opportunity to be able to provide the emergency planning framework through that, to be able to carry that forward. All of our programs that we were required to submit work plans and program logics for, we started building emergency preparedness into those frameworks to make sure it became part of our business as usual to talk about emergency planning. One of the things we start to recognise now, that in a natural disaster, it's not always a matter of fight or flight, that we see a lot of people paralysed by out of pure fear of not knowing what to do and how to go about things. So they're the kind of residents in particular that we now flag as going, well, they don't have a plan, they're not yet ready to engage, but they're actually the ones who we flag now through emergency services, say they're actually at high risk. And as I said, we, on the Watch and Act, we help them go in and get their things out. Thanks, Charlotte. So some of the things that we've learned, one of the things was, for our organisation, we actually as ourselves completely get cut off. So how can we be in there to support our communities when we are too impacted by the disaster? But we've sort of found safe ways to do that without getting in the way of emergency services. We don't consider ourselves an emergency response agency. We're just looking at our service continuity of the services we already provide. In the last flood in particular, our connections have certainly paid off. We have a number of case studies of, we genuinely feel that some lives were saved with communities who weren't prepared to evacuate even when told. So we'll be able to call those through to the SES, even when the phone lines were blocked at some stages. We had the connections to be able to say, look, we genuinely know that there's a person at severe risk, and they went in and helped get them out. Our own depot became an island. I won't go through all of these, but effectively we ran out of fuel in one area, but we were able to call through to the emergency operations team and get our vehicles refueled to continue on to do what we were doing. The SES, we had a situation where they were trying to evacuate a lady who was a carer for her husband with advanced Parkinson's and dementia, had never been into respite care or disturbed from the home before. We managed to call through the emergency operations team to be able to say, look, going to an evacuation centre is not going to be appropriate in this situation. So we worked with the SES to help them, and through Meagan, we managed to get them directly into residential respite for the night as a couple, and have Department of Communities and Justice recognise that as an evacuated situation, and provide some support. So it's very much an outside the box to what your normal regulations and requirements would be for temporary accommodation. Thanks, Charlotte. So this is just some of our team. So now in future events, we now position our teams for business continuity in the evacuation centres. They just roundabout, they're not to get in the way, but effectively lend a helping hand for how do we look at community transport in particular, or food and other things. We keep an eye out for clients who may be aged or disabled, who don't necessarily fit the mainstream of temporary accommodation. We make sure we do the advocacy that they go into an accessible temporary accommodation situation and so forth. And then even then, through some advocacy that we've had to do, we had to help look at care arrangements whilst in temporary accommodation, which was not something that was readily prepared for prior to that arrangement. Thanks, Charlotte. So I suppose just in reflecting on where we're at the moment, and don't forget that we started this journey in 2018. This has not been just something that we just cooked up in the past 12 months, but really understanding the assets and capability mapping of within your local areas has been really quite critical. Whilst we're sitting here talking about peppercorn, we do a lot of work with our other community providers and talk about emergency partnerships. So a lot of the community presented at local community centres opposed to evacuation centres. So tapping into them in terms of what resources may they need in future events. Having Meagan now on the local emergency management committee and through the operations team has just been phenomenal. And we're very privileged to be able to have that, to be able to call and sort of say, when we see high risk situations that emergency services may not be seeing, that doesn't need lights and sirens going to people, how we might resource that. One of the key things is to start small before you go big. So encouraging providers in your local area to take small steps. They don't have to necessarily be sending a bus out at 9 o'clock at night to pick up people. It may be just having those small conversations when they're doing an intake with a client. What might your preparedness plan be for the future, and who are you actually going to call? Who knows about what your plan is? And yeah, so timing is really essential. So one of the things, we've got high dependencies, communities of high dependence on service systems to evacuate. They can't wait till an evacuation order comes. If you're waiting for that, it's too late. So we're really taken a preparedness model of stepping in and supporting people with the premise that we know it's going to escalate. So a lot of those community, the conversations that we have, for instance, with our liaisons and our local officers at SES, we can call them and say, look, we just need a little bit more of a heads up. If you think this is going to evolve, we won't be raising the alarm, but we really have these high risk people that we would like to go and support. And then one of the key things is respectful interagency advocacy. We're all kind of critical of each other at all times. That's the way we work. We're in an advocacy space, but identifying where we can sort of see systematic improvements and changes going forward. Thanks, Charlotte. I think that's the end for me. Oh yeah, and the number one thing, just put your face mask on first. So there's no way in the world we could go out and do all of these things without making sure that ourselves as workers, my workforce, who are amazing volunteers and staff, who go the extraordinary mile during any of these situations. But we're really identifying that the face mask being put on first is in the emergency preparedness space, not necessarily in the actual disaster event itself. Thank you.